Aquagenic Urticaria by Chelsea Wallenberg. Aquagenic urticaria is a form of physical urticaria which is more commonly known as hives that is very rare. This condition occurs when the person comes into contact with water and small red raised itchy bumps appear 1 to 2 millimeters in size but are more distinct than normal hives. It takes anywhere between 20 to 30 minutes of coming into contact with water that symptoms arise, and between 30 to 60 after the water is removed, the symptoms disappear. Some patients will report itching regardless of the temperature of water. It has been reported that it's an allergy to water. Some people develop hives and itching after being exposed to tap water, some to filtered water, and some to both. However, there has been nobody that has had difficulties while drinking water. A person with aquagenic urticaria would show hives along with erythema, which is painful lumps or swelling wheals on the person's body wherever the water encountered the skin. The swelled lumps will vary due to the person's response. The lumps will more than likely be red due to pruritus. The red lumps will show that the patient was recently touched with water, and depending how long it takes to disappear, shows a small time frame when they came into contact. The primary care physician should ask if the patient has any allergies, because the lumps could be as simple as a bee sting. The patient's blood pressure may also have risen due to pain. Some may also experience swelling in the throat from drinking water and possible wheezing, along with respiratory problems. Since aquagenic urticaria is so rare, there's a very limited amount of data found for the condition. No lab tests were found to identify it, but in cases where women or men were diagnosed with it, their complete blood panel, urine analysis, and liver function tests all came back normal. There are multiple ways to test for aquagenic urticaria, but some of the more common and simple tests will be to apply water to a portion of the body. This can be in the form of a wet paper towel, their hand dipped in a water bath, or even as simple as an ice cube melting inside a plastic bag being applied to the skin. If after removing the water from the patient, it should only take a few minutes to see the hives or rash, and the patient may state that it is itchy or burns. Some other physical findings from this condition would be swelling on the face and possible dry eyes that may even be sore or red. The cause of this condition is unknown due to the rarity and a very minimal amount of reported cases. Out of the reported cases, however, there has been several different ideas as to how it develops. Some cases have shown that women who have siblings that have the Bernard-Soulier gene have a much higher risk of getting it. Others say it's an allergy that people develop over time, considering no baby has been reported to have been born with it. The earliest age that has been reported is 18, and it was in a male. The allergy, however, affects a wide variety of age group, so it's hard to pinpoint who will get it and who won't, since not much work has been done. Other theories that some scientists pondered were that people were having an allergy to what was in the water, not the water itself. The other was that a toxin in the water is combining with something on the skin, thus combining and making a toxic material. Treatments for this condition are mostly medicine-based, since scientists or physicians are convinced it's an allergy, or because the condition acts like an allergy, they will prescribe several antihistamines such as loratadine, fexofenadine, sertazine, diphenhydramine, and promethazine. They may also prescribe a topical corticosteroid, which some emulsion creams may also help to create a barrier when swimming or playing at a water park. Ultraviolet radiation and epinephrine are prescribed for more severe episodes of the condition where the skin becomes very irritated. Some uncommon therapies are the drugs stanozolol and capsaicin, which are both used in different ways but have been found to help with the symptoms of aquagenic urticaria. The last therapy that is odd is PUVA therapy that can be increased gradually and has shown to help with the itching and lesions to go away. Usually the antihistamines work, which allows for the individual to live happily. There have been no reports of death after the diagnosis. It is just a skin condition, and since people can drink water and not show any signs or symptoms as long as they are taking their medications or doing the therapy, there should be no problem. There's no cure for this disorder, and since no one is sure if it's genetic or not, it's difficult to find the cause. However, physicians can treat it, and so far several patients have stated that the various therapies have worked. Everyone is different, so while one patient might say the antihistamines work for him or her, the other patient may say the radiation therapy is the best for them. In conclusion, finding that this is a rare condition, it should be a good idea to inform the patient to keep a journal at their bedside, keeping track of every time the patient has an outbreak of hives or a rash and what did that could have caused it, and what they did that could have caused it. Also, to continuously recommend that the patient talk to their primary care physician to make sure they are doing everything they can to control the symptoms of the condition. Thank you.